Actually, my story starts from 2016 when I enrolled into MBBS at Surgical. Through the years of MBBS, super specialty is really far everything. Coming to the preparation, I think I started that in fourth semester of my PG around 2023. From that time, I started to see videos section by section.
I'm Dr. Rohit Garg. In my college, we don't have much exposure to urology branch. Only we got 15 days posting during our third year. So much of my knowledge and interest came from Venkatesh sir.
Similar to Rohit's story, I actually subscribed to the doc tutorials package in my second year.
I joined my MS program in 2019. Gandhi Medical College, Nagpur. We were only 5 residents working in 5 functional units. The only target for the first year was to survive.
Dr. Vaishak sir is my senior who taught me everything from basic stitch to the exploratory laparotomy. I'm happy to sit along with him.
Don't know how you are going to survive that. Because after the interview, I should tell the real fact also.
I heard that surgeons are more prone to be attacked by attendants.
I think you are going to ask a question. I heard all surgeons are attracted to girls. Good morning to all. I'm Dr. Rajamahendran here. NEET SS Surgical Group Coordinator from Doctor Tutorials. So I'm happy to welcome some of the toppers of NEET SS from Doctor Tutorials. So they have come from various places to explain you how they have prepared and how they have come so long distance to get this seat, and all of them have joined already the MCH, the dream seat of their choice. So I also welcome Dr. Venkatesh, my colleague, urologist.
Hi all. I'm Dr. Venkatesh. Urologist and transplant surgeon, Kaveri Hospitals, and I'm a part of NEET SS Surgical faculty team. And I'm really happy to meet all our students here. And on the outset, I would like to congratulate all of you and thanks for coming out here. I think it is a nice moment for you to share all your journey. I think all of you would have come across different obstacles and difficulties during preparation. So all this, whatever you are going to share, is going to be there for years together, and I hope it is going to inspire a lot of your juniors and younger generation as well. So thanks again, and thank the team Doctor Tutorials for giving us this opportunity as well.
So I think we will start with the introduction of all the toppers, what rank they got, and what seat they have joined in the counseling. So please introduce about yourself, sir, one by one.
Hi everyone. Myself, Dr. Vishesh Gupta. I got a rank of All India rank 7 in recently conducted NEET SS, and I have joined MCH Neurosurgery at GB Pant Hospital, Delhi.
Hello everyone. I'm Dr. Rohit Garg. I secured All India rank 12 in the recently conducted NEET SS 2024 examination, and I have joined MCH Urology seat in VMC and Southern Hospital, New Delhi.
Hello everyone, I'm Dr. Yash Jain, and I have got a All India rank of 11 in recently conducted NEET Super Speciality exam, and I have opted for MCH Urology course at IKDRC, Ahmedabad.
Hello everyone, myself Surety. I have done my MS from JIPMER, Pondicherry. I got All India rank of 15. I have chosen Surgical Gastroenterology in AIJ, Hyderabad.
Hello viewers, myself Dr. Vaishak Rai from Bangalore, and I secured a rank of 8 in this NEET SS exam, and I'm planning to pursue surgical gastro and I've been allotted in Asian Institute of Gastroenterology, Hyderabad.
Hi everyone, myself Dr. Ashish Jaswal. I secured at All India rank 20. My dream branch is Surgical Gastroenterology. In first round, I allotted AG Fijay Lucknow.
Hello everyone, myself Dr. Gopal Gade, and I have got a rank of 46 in NEET SS, and I have allotted a MCH Gastroenterology at Usmania Medical College, Hyderabad, and I am planning to pursue a MCH Gastroenterology.
Great to hear all the toppers selecting different specialties. You can see many of them will be always telling the top rankers should go for this specialty like gastro, onco. It is not so. You have to go with your patient. So you can see All India top ranker taking neurosurgery, and toppers who can get onco surgery also taking other specialties also. So it is not specifically you should go for this specialty or this specialty. It is always you should follow your instinct. Which specialty you love for always, you should go for that. That is what I always say. So because when I started my MS General Surgery career, at the time had a huge interest towards plastic surgery. But as days went on, I could find out I have more interest towards gastro, and I shifted my field of interest when I completed MS. Same way, you should stick with your core interest. Don't change your pattern of preparation, or don't change your mode of mentality according to the market situation. So go with your patient. Definitely, you are going to crack a great rank and going to have a great practice also in that. So let us see how they all have come across this difficult project and how they cracked a good rank. Let us go with one by one. Dr. Vishesh, you start about yours.
So actually my story starts from 2016 when I enrolled into MBBS at NEET. Through the years of MBBS, super specialty is really a far away thing. No one, at least I didn't think what super specialty at that time. I think no one thinks of that. But towards the end, as I visited surgery department for my internship, our surgery department had the habit that they used to post the interns into various super specialties also at there. So I think I like neurosurgery, whatever exposure I get. I used to go to some OTs that definitely, obviously not scrubbing, but I used to see some basic craniotomies at that time itself. When I gave INI CET in 2021, so I had an option to take the 6 years MCH neurosurgery course, but I thought that at that stage I was not that much committed, and I thought that I probably wanted to explore all the specialties further before committing myself to neurosurgery as such. So I got enrolled in MS General Surgery at PGI. And the thing about PGI is I got exposure of, I think, many super specialties, 4 to 5 super specialties there. And my mentor, Dr. Ajay Savlania there, he is a vascular surgeon. So I was drawn to vascular surgery initially for some time. But the thing that caused me to drift away from that mainly, it was that patient who had a femoropopliteal bypass surgery. He had his graft thrombosis. He was operated again a redo bypass was done, and we discharged him on POD7. So when he was going, he told it in my face that he will go and smoke again. So different people may take this differently, but what I felt was it is more of a branch where you try to save a person who is somewhere or other a victim of his or her own doing, to some extent, not always. For me, that was a drifting point away from vascular surgery. And other than that, I didn't like any specialty much besides neurosurgery. Again, in MS, when I got to the neurosurgery department, seeing the surgeries there, spinal, cranial, and more than that, the exposure with the neurosurgery SRs that I received at the trauma center. Because in PJ trauma centers, the senior resident who was always there with us, even more than the general surgery SRs, was the neurosurgery SR permanently stationed there. So I had a good exposure, good rapport with them. And as it went further, I found my interest developing more and more. And coming to the preparation, I think I started that in 4th semester of my PG around 2023. So from that time, I started to see videos section by section till mid of 5th semester, after which I had to shift my focus for MS exams. I completed my MS this February 2025. So after that, I was at my home. I used to revise daily from morning to around evening. And what was my practice was that I used to attempt one grand test every night. So I think that definitely notes, videos, those things helped. But what gave the confidence to face the exam as such and to be calm, to apply the concepts, to apply everything that you have learned and get the results was that practice of doing a grand test every single night almost. I think excluding the weekends only. And yeah, that has been my story. Thank you.
Great to hear. So I think the 2 of our students who got urology, I think Dr. Venkatesh sir should question them about the urology. Sir, please, two of your mentees, those who took urology, please talk with them.
Yeah, really happy to see budding urologist among us. Even my sessions, I always encourage my students to take up urology to have some. Personally, I would say like for most of the MS residents, we've been doing, unless you're posted in a very high volume urology center, you don't know even a basic of what urology is. So that's why most of those MS residents during the residency, they don't have an idea what urology per se is. That's why whenever I take a class, I take it an opportunity to explain them, delve into what are the different subspecialties of urology. So at least some of you could gain an interest and have an inclination towards urology. I'm really happy to have two of you here, and a lot of other students have also messaged me that really had given the pleasure. Congratulations. So Rohit, I think it's your time. You can just tell about your journey.
I have worked hard before. I have prepared notes, so I used that notes. I revised them multiple times. Then I started giving grand tests and mock tests to identify my weak points, my weak areas, and strengthening them by doing more revisions. Initially, I used to do mock test every weekly. Then I increased the frequency to once every 3 to 4 days. Then in the March, I was giving every alternate day. The mock exam, they really helped. In my college, we don't have much exposure to urology branch. Only we got 15 days posting during our third year. So much of my knowledge and interest came from Venkatesh sir. Regarding the branch, I think the branch is very versatile and we can have quite work-life balance, and more patients morbidity is not that much as compared to other branches. So that's, and also I think the branch is more technical, and I'm being more a tech savvy person. I like the robotics and ideas of robotics and all. So that's why I started developing interest in urology. Then I read about the urology disease and treatment from the source only and watched many videos. That's how I decided to pursue urology in future.
Great story to hear. You will feel even more happy once you join the residence of urology. There are a lot more things to take actually. Like, yeah. Discuss about your journey towards this thing, Doctor. Please.
Actually, similar to Rohit's story, I have also joined my MS course at St. GS Medical College and KM Hospital, Mumbai in February 2022. I actually subscribed towards to the doc tutorials package. I think in my second year, the final year of my MS, it was quite mentally taxing. So although even if I had free time in my hand, I couldn't dedicate myself towards the preparation. So during the preparatory leave before my MS exam, the university exams, so at that time I shifted my focus towards completing the videos and notes. So the first subspecialty that I covered was urology. I gave the exam with a lot of confidence, and even after attempting the exam, I was confident that I had given my best. So all thanks to Dr. Tutorials and Venkatesh sir and Rajamahendran sir. Thank you.
Nice.
Nice to hear.
Nice, inspiring story.
So one important thing like which I have observed is like most of you guys, when they are preparing for the university exams, they gave a break for the preparation towards this NEET SS entrance and focused on it. But what you have said is like you have even given your whole university exams based on the contents.
Yes, sir.
What are the stuffs that you have. So that means if you are thorough with whatever the contents, it's suffices for both your passing out your MS with good colors and also your entrance exams, right?
Definitely.
Of course, the materials are the same, but it's a mindset of the students. That's what I would say. Like, because even whatever the contents which you are giving are actually taken from the standard textbooks. So rather than jumping from one resource to other, just trust one of your reliable source. And as Sir said, revision is the key. So there is no point in hopping from one place to other. Trust your resources and do your revision. Like just exactly like what he has just said. I think so. It's nice to hear from you.
We no need to depend on some corporate hospital or some bigger centers. We can start a small OP like this size room. With an endoscopy on one side and a colonoscopy on the other side. We can start the practice. Minimal investment and maximum volume of cases in surgery is from gastro. And apart from that, the major reason why we take gastro is many people tell whatever work done by gastro is done by general surgeons, but it is wrong. Whatever done by general surgeons will be done by gastro is the original thing which is happening in practice. See, even now when I have my OP, more than 60-70% of the general surgery cases come to me. I will never say no because they are just extension of our course only. So therefore hernias, hemorrhoids, fissure, fistula, all those whatever you learnt in your MS period will continue. Your volume of cases will be high. That is one of the reason. Unlike urology, neurosurgery, totally different field. We have no idea about it when we join those courses. That is one of the reason why people prefer gastro. For MS, one of our students joined JIPMER first year last year. One of our NEET PG students, she joined JIPMER. She is very much interested in surgery. She joined JIPMER. Within 1 month, she started calling and crying to me. She took photograph of her legs. It is fully swollen with the edema, full both legs. She is telling, sir, I could not sit for past 48 hours. I am standing only. Just to say 2-3 hours I am sitting. Like that, it was very hectic. I am going to leave the course. I was wondering, what, madam, you have so much interest in surgery, you are leaving the course. No, sir, it is good here, but my body is not withstanding. I am going to go for radiology, and she discontinued and joined radiology in NEET PG. That is that much hectic course.
Sir, I joined my MS program in 2019 from Indira Gandhi Government Medical College, Nagpur. Basically, it's a small hospital, but the amount of residents were also less. We were only 5 residents working in 5 functional units. The only target for the first year was to survive. That was the only target, to be honest, because you're getting sometimes 48 hours to 72 hours double shifts, back-to-back duties, Sunday, Monday. So all those things were there. So just to survive without getting any tuberculosis was my target for the first year. Then the second year, third year, the only problem with my college was there was no super specialty postings over there. So whole 3 years was a complete general surgery training. And our consultants only used to do nephrectomies and most of the onco cases, esophagectomies. So we had exposure. We didn't have exposure of endourology, for example, or neurosurgery. We didn't have much exposure on that. So our interest, and this is Dr. Gopal, is my junior from the same college.
Yes.
So most of our interest was between onco or gastro, because that's what we were exposed to the 3 years. And I had no plans of preparing for SS initially, and my interest was towards doing minimal access surgery. But once I finished the MS training and I served my bond, when I came back to Bangalore, I realized if I want to do some advanced surgeries in minimal access, I think somewhere I felt the need for super specialty training. So that is when I started preparing for my exams. And to be honest, comparing these people, I think I'm the senior most seasoned player in NEET SS exam. So this is my third attempt.
All
actually.
the more we want to hear stories from people like you.
Yeah.
Okay. Because that will inspire even bigger
Yes,
chunk of people. Actually.
So what happened was when the last exam was conducted 2022, my rank was somewhere around 2,500. Then I was seeing all these interviews. The fresh passouts are clearing, which is a high ranks. And I did from a very average college. There was a self-doubt whether, I could crack this exam, I could get the seat of my choice. Because gastro, I used to keep a track of the previous year's counseling. So I used to know it's a very, high cutoff subject. And I was very clear that I didn't want to enter any private college for that matter. So I was very clear that I wanted to go to a government or a DNP institute and take up gastro. So when I used to see the cutoff, I had this doubt, like, can I do this? When I'm seeing like an interview like this, some viewer might be watching from some college thinking about giving a second attempt. So I was in the same state last year. So then I decided I'll give one more try and give my 100% for the preparation. And I promised myself this is going to be my last attempt at NEET SS. Come what may, this will be my last attempt at NEET SS. So I had a plan that the last year, the one more confusion was the dates, whether it is going to be in September or not. I was working in a place and I planned I quit my job in May so that I can have 3-4 months of extra preparation. Unfortunately, the exam got postponed to March, and the college where I left, the vacancy was already filled. So I didn't go back. I didn't wanted to waste more time finding a job anywhere. So I said it to myself, okay, I'm risking everything, so let me go all in this time. Anyways, another 4 months of preparation. Totally used a doctoral platform for my preparation, to be honest.
Great story.
So it's a nice, inspiring story, sir. Thank you so much. So we'll next move on. Sir, please tell about your story, sir. Sir is also having an inspiring story to tell for all of you.
Actually, my story started when I completed my MBBS in 2014. At appearing, I got a seat for counseling. At that time, only hardly 10 seats are there in state of Uttarakhand. At that time, people say that you have to take any end branch like ophthalmology or ENT. But I think I choose either general surgery or general medicine, because I think at that time only super specialty programs are running for those courses only. But my interest is in general surgery. Then I joined general surgery in 2014 from GMC Haldwani, Nainital. I completed my general surgery program. At that time, no time I got for preparation. At that time, a very hectic schedule. We are only 4 resident. But at that time, I think that okay, why I joined general surgery? Why I joined general surgery? Because I want to further study like for super specialties. At that time, I had only one exposure in neurosurgery. In my college, only neurosurgery super specialty department are there. I work there. I independently do BP shunt and a few emergency craniotomy also. But later on, after completing my MS General Surgery program, I go for a residency program. Then at that time, in AIMS Gorapur is initially opening, which is my hometown. I go there, go for interview. I got selected. I started my senior residency there, but there are no time for preparation. After 3-year completion of my senior residency, I thought that why I choose general surgery again. What I will do? What will you do? Then it's a tough time for me because 3-year senior residency is completed. Then I decided I will starting preparation for super specialty. At that time, I am having a child also, but decided to start study. From my residency, I see Rajamahendran sir books like short cases. I bought that and studied those books and searched the program, which programs are run for super specialties. So then I saw that doc tutorial. That time I started video apps are there and offline classes are planning at that time. And once a time I go for Chennai for crash course for a 4-day program.
Such a long distance you came for.
Yes, I'm from Gorapur to Chennai. In 2022, I wrote exam but got almost 770, around 770 rank. It is my first time preparation. But sir say that you have to read sufficient, eat sufficient, drink sufficient, each and everything is sufficient. So I think how I will cover that. It is very tough for me. I am live with my family. My father is suffering from carcinoma lung. I will be there, and how will I do job? Then I saw that if you go for app and see videos, it is quite bit easier to read book. Then that year only I saw the video and solving questions and wrote the exam. I got a 770 rank. But at that time I realized that sir said that you have to prepare for at least 6 months. Then I realized that I prepare only for 1.5 months. How it could be possible to take a seat? And my dream branch is surgical gastroenterology. Then I again prepare for the next year. Next time same problem are there, but next time then I prepare for 1.5 months, not for more. But that time notes of offline classes notes are available, which I can purchase, which is easier for me. See the video, read the notes, see the video, read the notes, and updated my notes. And after updated my notes, I realized that video is over and
Notes is over.
notes, and you have to read and only a notes. And sir says that revision is most important thing. I think it is hardly 1500 pages. I realize that I can summary in 1 week. If I revise in 1 week, it will be 4 revision in a week easily. But second time, third time, fourth time, it is so easier. That time again wrote the exam. Rank is 770. Same, almost 5 rank is differ. I depressed and so thought that quit the exam. But I think why I opt general surgery for super specialty. Again, I will never satisfied from this. I see the interview last year first ranker Dr. Jadev, ranked 180 something in previous exam, but not opted any seat because his dream branch is surgical oncology from Tata. Then I realized that if he got 180 rank and not opted the seat, my rank is 770. Why I do my surgical gastroenterology from private college? See, another student also query this type question from Rajamahendran sir. Say that you have to go one attempt more and give your best. And I think I realized that what are the problems are there. Few months I prepare for 1.5 months with job and family. Then I realized that why I have give up all the things and sit for 6 months and go for that. But it is not possible with all this happening around you. But this year I think that it is my last attempt, and I will sit at least 3 months, not for 6 months. It is not possible. I read because notes I don't change any platform. I use only doc tutorial video, only use doc tutorial. But one thing I always in my mind, in Gita say that you have to do your karma. I am highly inspired from कर्मण्य वाधिकारस्ते मा फलेषु कदाचन मा कर्मफल हेतु ब्रह्म ते संगोस्त कर्मणि. So I think that your work, you have to do work only. It's my thing, not for result. And it is my last attempt, and you have to do your whatever best possibility for there. And in the last moment, I thought that you have to read only, not thought for result. After exam, I have not any discussion for questions, not waiting for results also. This is my story.
Then you got a rank of
20.
that is very important. No?
This is
See, people should know
when my result is rank 20, I can feel little bit confused. Rank is 20, how much mark I get?
Yeah.
So then I see this is no. When I see my result, 470 is my marks. I see that okay, 470. Yes, it's good rank for me. I will got this year. But I check what is the marks. I confused 20. How it is possible? 470 and 20. Then I scrolled the result and saw that the rank is 20 and marks is 470.
Your story is like watching a Hindi movie.
Yes,
Yes,
sir.
Last minute, some sudden changes happen. And
Exactly, sir.
Yes,
Exactly.
like that you have made
Multiple times I give up. But if one question said me, why you join general surgery?
Yes.
Not
This is
give up.
the topic of your heading is why I joined general surgery.
Yes,
That
sir,
is the
yes,
main
sir.
heading.
Yes.
We should take a movie with that. Rita, you should plan a movie with sir. Why I should take general surgery? That is the heading of the movie, and you should track his full career. Yes, he is preparing for more than 5 years, and now he is ranked 20. People who are preparing for 1 year are crying, I could not get a rank. That is what I am very much upset. I am seeing people who are crying, sir, I could not get a rank for preparing 1 year. See, please, those who are crying for not getting a rank in 6 months or 1 year. See here, a great person who follows Bhagavad Gita so sincerely and gets a rank of 20, and he is very casually sitting here in front of you after so much of struggles. That is what we expect from the aspirants. It's a great inspiring story, sir. Thank you so much for this story. Next time, I would like to talk with Dr. Gopal. He is not only our topper, he is our faculty also. We used to have him in many of our small test series. He used to cover a lot of topics, and he is one of our residency faculty now. So welcome, Gopal. Please introduce about yourself and your preparation things.
I'm Dr. Gopal. I'm done I MS General Surgery from IGMC Medical College, Nagpur. Dr. Vaishak sir is my senior who taught me everything from basic stitch to the exploratory laparotomy. I'm happy to sit along with him in the same studio with Rajamahendran sir. And basically, I come from a very rural background. So the only dream I have is how to pass MBBS and how to do a job of medical officer in primary health center like Gram Panchayat full area, like that series. So after MBBS, I have joined the medical officer job, and I am doing that job with happily. But suddenly, some of my co-MO, that is some medical officer, have gave the NEET PG, and I have selected for the PG. He take the general medicine. So I am thinking also that if he can do, I am also can do the PG. I started my PG preparation with that only saying the YouTube videos of Rajamahendran sir. That was the when the RRM Next app is available there.
Okay.
So I was used to see the videos of Rajamahendran sir, and frankly speaking, the only super specialty I was knowing about at that time is the gastrosurgery, because the Rajamahendran sir was the gastrosurgeon, which is I used to see in my mobile screen. After the PG preparation, I have got decent rank. In my first attempt, I have selected for KM MS General Surgery. But sir, as you have already talk about that Jipmer and that college, KM is also same like. You have to just only have to work. Toxicity is there. So within 2 months of my joining, I have left the seat of KM. Okay. Everyone is shouting on me like, why you have left the MS General seats of KM? Okay. But the only person who is stand with me is my father. Before leaving the seat, I have just called my father. I have gut feeling that I don't want to do surgery at here. I am doing surgery, but I will not do surgery at KM. So I have left seat. Again prepare for next year. I have next year again I have got rank of about 2000 in all India. Okay. So at that time I will get anything. So all my seniors who knows me, they are all you have to take medicine this time, you have to take radiology this time, don't do surgery, you are not mean to be a surgeon. But from my gut feeling, I was if I am doing the post graduation, I will only do the surgery. Other than that, I will be happy with my MO-ship job. I have done some studies of all the colleges from the Maharashtra, and I have put only one option: Indira Gandhi Medical College, MS General Surgery, and hopefully, and that time luckily I got seniors like my who had actually the working environment is more important than the institution, the name
Yes.
of the institution. Like some institute have very large brand name,
Yes.
but actual these are helpful for resident or not. It is actually a personal opinion. And initially I just want to be a general surgeon, so I want to be a good general surgeon. So I have chosen a good institute for me to be a general surgeon. After that, for the I like Vaishak sir said, I don't have also to do a plan for super specialty. Last year I have joined as a bond for a government bond in Government Medical College Baramati, doing surgical senior residency there from January 2024. From that, simultaneously I am doing my preparation for NEET SS also. And during that phase, in May 2024, I have married with Dr. Rushali. During that phase, started preparation for NEET SS. So the only thing I have talked with my wife, मैं अभी preparation करने वाला हूँ, इसका time नहीं मिलेगा, शादी के बाद tension नहीं चाहिए. So she is like, okay, you do your work, I will be there only. Okay. So she is also working with me in same institution. Okay. So after that, I have done preparation for. It's not just like done for last 6 months or 3 months. My preparation was from January 24 to the up to the exams of this exam. So it is not just. So it is the NEET preparation or any competitive exam preparation is not like a short race. It is we have to be a lambi race ka ghoda. So I have prepared the last 1.5 year, and used just the doctoral app, and luckily in the mid of the 24, you have messaged me regarding the classes, and it was like a dream message to me also. So to get a message from you, sir, and I have happily joined at part-time faculty in doctorate also, and done some recordings of surgery residency program also, sir. And actually, that was helpful for me also for NEET SS preparation.
Yes, correct.
So that was like a part of my preparation only, and that would be very helpful for me. And that's just my story, sir. And thank you so much, sir.
That's great.
So to help to reach from that MO who is doing medical officer at PHC, and now I am going to do a MCH gastrosurgery, sir.
That's great to hear that.
Thank you, sir.
Great achievement. Definitely, all the stories are inspiring from all of you. Surgical field, you should be ready to wake up at any time. See what will happen in future once you start your practice. You are getting a call at 1 o'clock or 2 o'clock night midnight. They are calling you for one obstructed hernia. Will you say no? I am not able to come tomorrow morning. You are losing 50,000 rupees. 50,000 rupees is gone. So that is the surgery. No other specialty will get calls like this. Only surgical specialty will get emergency calls. So we have to be ready for that. See, you should be able to sleep whenever, wherever you. If you allow me to sleep, I will sleep here.
Yes.
Within 1 hour, I will sleep here. If you all, whatever you may be ready, I will sleep here for 1 hour. And I will wake up and look after. That is what needed in surgery.
Yes,
Yes,
You
sir.
should be able to sleep wherever, whenever, whichever place.
Which,
Over shouting, there are also some casualties. You know, we will be sleeping on one
yes,
side.
sir.
Sometimes we will sleep on one of the casualty bed silently on one side. That and all we have to be trained. That's a part and parcel of surgical curriculum. But the only thing in toxicity is insulting in front of the patients. The PG is being insulted by a senior PGs in front of the patient. That and all definitely come under toxicity only. That and all to be avoided. Toxicity is very important in surgery field. Is you should not insult your junior PG in front of some of the patients, or even the assistant professors or professors should not insult any PG in front of. If they want to scold them, let them take them into the room. They even beat them, nothing wrong. But scolding in front of the other colleagues or junior PG, sometimes as you see, two of your one batch. Sometimes what happens? The senior will be your junior. The MSPG senior will be your junior, and if you get a scolding from the assistant, it will be very looking very bad. So the senior, what will others think? Therefore, I feel that should be the one major toxicity I feel. And sometimes what happens, they will start asking to do the same work again and again.
Yes.
It will be good, but they will ask you to repeat. It is not looking good. You do the same again and again. They will ask you to do the same work. In Madras Medical College, I feel the toxicity is to ask the surgeons to go to the blood bank. That is one of the major toxicity. We have to go to the blood bank to get the blood like an intern. And all some toxicities are, they say it is a protocol. That is the problem. Major problem is no one will be accepting to take a back step. Everyone will say this is the protocol. At least when I was becoming a senior PG in those days, I started doing the same work which I did in first year. I never asked the first year to do the work. Something which is done as the first year in the protocol, I do it in the second year also. Sometimes the first year PGs himself will think, sir, what you are doing this? If you want, you also come and do. I will do this. You don't. If you are interested, you do, or else I will do the same work. That's all. That the toxicity naturally went
Breaks
down
away.
as it breaks. Somebody has to break the toxicity. That's one of the major issue. Otherwise, the surgery residency is one of the happiest period in my life.
Yes,
I am 45 years now. If you ask me which is the happiest period, I will only say the 3 years of surgical residency is more happiest period than MBBS. So therefore, residency is a place where you should enjoy. The toxicity will be one side. On other side, we will come to the room. We will scold every professor and assistant professor in all bad words we have.
Yes.
We will put a room. We will come to the room after having dinner. We close the room. We scold that fellow useless. Whatever bad words we have in our language, we scold that fellow in all language. That will bring us big piece of happiness. That is what we always do in surgery residency. Therefore, you also do that and you enjoy it. After that, next day you see that fellow, morning sir, good morning sir.
So you are seeing this example.
This fellow is telling, he's telling it.
He would have. I'm 100% sure he would have done the same.
Major toxicities we cannot overcome, but I am feeling very bad because in our days also there are toxicity, but no students will suicide and all in those days.
Yes, sir.
Now we are seeing suicide. Because of toxicity, students going for suicide, radiology aspirant going for suicide and all is highly unacceptable nowadays. I don't know what much of toxicity, whether the toxicity level is high or the student's threshold is low. Something is there.
Sir, nowadays, sir, basic is from internship also, sir.
Yes.
The students are not doing proper internship. they are going for NEET PG preparation. So they are leaving the wards, they are skipping the duties and only sitting for the NEET preparation. So they don't see what is his resident or her resident is doing right now.
As a resident, they
so
are doing.
so as a resident, so they just take a good rank and they choose a specialty, but they don't see the what is surgery resident doing in
Doing there in
hospital. So and after joining the PG course, they are like, this is unexpected.
Yes.
So they haven't seen their resident doing the same thing.
Okay.
So that's what lacking from PG before joining PG also, sir.
Said my juniors the same thing, sir. Which branch to choose? You do internship properly.
Yes,
Whichever you see the work,
you will
whichever
understand.
you see yourself.
Yes.
Like I was very sure what I don't want to do.
Yes.
OPG was one thing I never imagined I'll do it in my life, because in internship that experience, that is where somewhere this I had accepted the fact that my surgery residency is going to be very hectic. I knew that before coming. I was mentally prepared. Okay, this is how my life is going to be for at least 1 year now. So when you're mentally prepared for this, you won't feel that this one. And
Yes.
work is not toxicity, to be honest. If you are working without gaining any knowledge or experience, then that is toxicity, to be honest. If you are getting to learn a lot, like I have an example where me and my senior, we had 27 cases emergency OT the whole night,
All night.
like from 4 o'clock in the afternoon till next day morning, like laparotomies, debridements, everything included. I was just calculating how many hours I'll get to sleep. By the end of 26 days, I realized I can't sleep. I have to run to ward now. So the 27th case was an appendicitis patient, and I have just been 2 weeks into residency, and that was my first appendectomy. The whole exhaustion which happened throughout the day, I forgot
went off.
it.
Yeah.
Went off after that case.
That is
So,
very important.
Yeah, so if you're learning a lot and you're doing a lot of work, and that's the best place you are in right now. Be happy with what you have.
Problem is, wherever you are busy like this, there will be no toxicity.
Yeah.
Wherever
Nobody
there is
has
no
time
work,
to-
there will be more toxicity.
Yes,
Because everyone don't know what to do.
Yeah.
So they will start torturing one fellow, select this fellow, torture him. We don't have any other work. That is what happens in most of the places.
Sir, at our places, the work is so much that if JR1 is doing, JR2 is also doing some work, and JR3 is also there.
Doing some
So
work.
everyone is there. So the JR1 doesn't feel that he is only doing the work.
Yes.
So everyone is doing
That much
his
work is available.
Yes,
there.
yes.
Work is
So,
available. there.
so that would not create a problem.
And our
in-
seniors, how much ever they built, we were getting cases to do.
Cases,
We were
yes,
happy with that.
yes, sir.
When you get more, when you
Yeah.
get cases, you will not scold anybody. You will be happy.
Yes.
Like you will
That is
do
the-
most of the work. That is there. So.
Sir, my attitude for this was like many a times, even if I was kept out of the ward, in some way or the other, I was helping the patient, and eventually, if the patient got his surgery done, and even if I was facing the toxicity, I thought that I am doing something for the
Other
patient.
public, yes.
Yes, and that was the gratifying part of it, even after facing so much that we used to face.
Who all have done from extreme north PGs? MS, you did from?
So the
So how is the toxicity there? Is it so much?
toxicity level
Because
was-
many students were asking whether to join that north. Many people from south,
Yes.
they never select north because they feel that there is toxic. Though the salary is good, we don't go. They torture us like that. Is it really there is a toxicity?
But earlier it used to be
Okay.
highly toxic, but it is decreasing
Now
nowadays.
Subject it is decreasing.
Sir,
So
I
that
tell
also
my
didn't
personal
show.
opinion, sir. Like, I'm from South Bangalore,
Yes.
and I did post graduation from Maharashtra, Nagpur.
Okay.
Place I'm not familiar with. Hindi, my Hindi was not that great. I didn't know Marathi, but I went there. First 1 month, yes, of course, they will monitor you, what you're doing, how you're working. But once if you're sincere with your work and you're giving 100%,
They
like
want-
I'm not bragging about it, I was one of the favorites among my
Yes.
bosses.
Yes.
Like though rest of them were from the same state.
local state.
So I don't know, like maybe in some colleges there is there, but you will be just based on the work you're doing more than where you come from, is what my opinion is.
Yeah, that's true. It doesn't stop there. The commitment, how successful you are, be whatever you do, MCH, whatever the specialty, unless you're committed to your job, which you have to learn from your residency.
Yes, sir.
If it doesn't root there, you can't be overnight totally committed after MCH. Your patients are very good in judging
Yeah.
how good you are. See,
They are the best
the
examiners.
degrees are nothing.
Point
How
is-
committed you are,
Yeah.
how truthful to you are, and what are the efforts. See, now I would also accept, like as we do MCH, during your clinical practice, you're not going to get straightforward cases. It's one way or other, it is going to be a complicated case where a general surgeon or anyone else would not be had guts to touch. So you were forced to do, you are going to do such kind of complicated cases. So in those complicated cases, you are likely to get midnight calls, late night calls, re-explorations, all these things do happen. So I think the root of success for a surgeon is the commitment and the 100% efforts which you are going to put in. Leave about the results. The results may be good, results are more bad. But all these things we are trained to do in residency. But unfortunately, the recent trend I'm seeing is even after coming to MS residency, where we are supposed to work and toil, people are taking the short course. They want to, of course, getting through MCH is important, but it should not be at the cost of leaving out your work at the residency.
Yes.
Because ultimately, your real success in life and your profession is how committed you are and how truthful you are. And fortunate enough, the more hard work you do, I think you all are standing examples by the way you spoke. See, everyone has given their best attempt, everyone has landed with very, very good ranks. Okay. So without hard work, nothing is going to come in line. But it is our duty to be committed and do the hard part. And rest all, we hope things fall in the right place at right time, which I think God is fortunate to most of us.
To be frank, you are all entering chapter 2 of Toxicity now.
Yes.
Chapter 1 is easy chapter. Chapter 1 is easy because at that time you are young guys. Now chapter 2, you are all already well grown up. Now the Toxicity 2 is much more toxic to everyone. I feel when most toxic period for me is the MCH course only, not MS or MBBS. I was happy during my MBBS and MS. When I went to MCH, the toxicity level is different. Maybe, I don't know, I lost the threshold. I was working as a legend in one government hospital. Whatever I tell, everyone will behave there.
Yes, yes.
Here I have to behave what the staff nurse is telling me. Okay, staff, like that. So therefore, you are going to be entering the chapter 2 of Toxicity, which will be more hectic and more stressful.
I am hearing that, sir.
Yes.
I am right now I am as a assistant professor in
Yes.
my department, and everyone knows me. And right now I have to do some basic from intracare.
Here
scripting the
you
patient.
will be treated less than
It's
a
like ward boy.
You
Yes,
think
sir.
yourself will be the ward boy for first year. Second year will be like intern. Third year will be considered little good courtesy. That's all.
Yes, sir.
That is what happens in MCH residency in many places. I don't know how you are going to survive that. So because after the interview, I should tell the real fact also. I should tell the real fact. You should not go with the happiness. Oh, we have joined with MCH.
Yes, sir.
The problem starts now only. Like in Robo movie, that villain will come and tell the real chapter starts now. And when the Robo starts hugging that Aishwarya Raida, that's they will tell. Now the real problem starts. Like that. Now once you join the course, the real problem
Yes,
starts.
See, but one good thing is like you're all taking the branch you are more passionate about.
Yes,
See,
that is the
this
only
is-
important thing.
MCH is like a marriage.
Yes.
Next
Yes.
40 years you are committed to this. General surgery, even if you don't like, you may not practice general surgery. But whereas it comes to MCH, you have to end up with that,
Yes,
whether you
have
like
to
it or
end your
not.
life with this.
So that's why like some of you also in need, because now the pattern has changed. So when we were preparing, we used to prepare core specialty. For example, Sarah would have read Bloomgart and Shackelford. I had read Campbell for my preparation. But now it's all a simple pattern, which we personally don't like. That is not the way to choose a specialty. But unfortunately, that's the way. But what is happening is now people get carried away. So they get a very good rank. So they would have opted to do a plastic surgery or whatever their means and wishes. So since they get a better rank, people get carried away. No, you should opt for this one. That I think I would tell, just go with your passion and guts, which you are going to be like. You don't get it directed by your rank of whatever you chose. So that is one thing I would want to add at this point. Because after this, there is no point of looking back. You have to be with that field, and I think all of you have chosen the one which you're very much passionate about. That's what, when it comes to toxicity, you can think that you are doing something which you're going to love, which you're going to do for another next. Your whole career is going to be with that. So that will take away that negativity. So whatever said and done, we will learn and do things. And I will tell you, doing even a small thing which we feel like can be done by any other person or what by or something like that. So don't feel inferior about that. So the one good thing is, like, when you go out and start your own unit, you can train all your ward boys, your staff
Yes.
nurses, everything. So that will tell you. See, you cannot order someone, your subordinates to do this work unless you don't know how to do that, right?
Yes.
See, if you don't know how to catheterize a patient properly, you don't know how to put a rail tube properly, at least you know you should, only then you can monitor your juniors and you can teach them. And however be or you are more commanding, if you know that you can do the work subordinate can do, then he cannot cheat you on that.
Yes.
So in that way you can build a team, very committed team on that part. That's the way. See, these are all, I'm also speaking from my own experience also. When you move out of a corporate and start a unit from scratch, then you think of, because during residency everything is taken care of. You don't
Yes,
look
sir.
into all small minuscule details. But when you're left alone, then you have to think about what are the things to be needed, how to set up an OT trolley, how to train your staff. All these things do matter.
Yes.
So it's nothing wrong being a scrub nurse, nothing wrong being a second assistant. There is always an opportunity for us to learn everywhere. And I will tell again, say, I think Sarah also that, see, during an MCH, this is a hard fact. Most of you would not be able to do major cases independently, but you would have seen your professors and assistants doing it. But the number of times you watch them and assist them, you will learn by subconsciously. So at some point of time, you will always learn that it's not always that you have to hold the scalpel and do the surgery from skin to skin. That is not needed. If you are very much committed, even during being a second assistant, you will learn small things in that part. I think the whole toxicity is because I would personally say, of course, there are toxicities in it, but I think it is also depends on our state of mind and how we tune
Yes.
to that. Right? So my thought process, like, you make one notes, there is no, whatever resources you make, you fill in that one chart.
One-
so
one
We cannot see
fit
multiple
in
sources.
everything.
It will be difficult.
Yes. Sir.
Sir, even uro-oncology. So
Yeah.
many concepts are there in each type of cancer. Still in one flowchart, it's all
Cancer penis, I was calling him and asking, sir, cancer penis, why you are doing like this when the node is like this? I was asking, he was telling that it is there in the flowchart. Then I saw the flowchart, it is explained very well in the
Yeah.
flowchart. No books explain that. For cancer penis, nodal management is best in his flowchart.
Flowchart. Yes.
Sir, I read the I have a PDF, but I think it is little bit complicated. But when I see the video and flowchart, I thought
It will be clear.
it's too easy.
Yes.
I have to note them and but learn a few points and concept is clear.
Even in NEET, the NEET SS exam, sir, the uro-oncology part, I thought barely nothing is given. All these flowcharts are there. Sometimes we feel they are bit more
See,
than
that's
one.
a reason-
Campbell based.
But too many questions were asked. Testicular cancer, I
Yes.
think
Yeah.
3-4 questions were asked.
That's what we've been discussing with
Yes.
Sir. At least the new edition Bailey has
Fully updated.
updated. The main challenge for me for taking NEET SS was with the old edition, where most
So
of the
many
facts
mistakes
are
will be
absurd and wrong. So it's very difficult for me to teach a wrong fact because you guys don't treat Campbell, so and you don't expect to teach, and I can't teach a wrong fact on that. So at least the new Bailey has simplified life. But that's why even urology, like, I go beyond Bailey and Love, and because you need some basic concepts to understand.
One last question though I have.
Yes.
I heard that surgeons are more prone to be attacked by attenders. Has anyone of you had any of those
I
kind
think
of
you are going to
experiences?
ask a question. I heard all surgeons are attracted to girls.
That is also true.
You are asking attracted by attenders. You should have asked a good question.
You should have finished on a nicer note.
No, surgeons are not attacked by people. It is physicians only. Most of the time, surgeons, many people always think medical legal issues are more with surgeons. That is absolutely wrong. Because we are trained with the method that we get every concern in depth. But physician people, no, they don't get that much serious concern. They just like they treat a patient and the patient dies, and that creates the problem. For us, we are going to deal a surgery. When we are going to do surgery, we give all the concerns. Everything can happen. They can't give sign. That concern, if you get properly, nobody will beat you. If you don't get a proper consent, they will beat you. That is what actually happens.
And
I don't
Basically,
leave
in
it.
surgery, we have to teach about counseling and consent.
Yes.
How to deal a patient before surgery, how he give consent. It's we convincing the patient and give more time to patient.
no, that is what here I would I would go back to that residency training and
Training,
toil.
yes.
See, how much time you have spent with your patients at what side, bedside. So the amount of efforts you have spent with the patients at the bedside, counseling the attenders and stuff, explaining everything, surgery in detail, what are the complications. So even sometimes you do get complications. The attenders realize that, they know that, but if they know that the surgeon has done he's given his best to bring the patient out of it. Of course, when it comes to a corporate job, everything, any complication lands up with a lot of cost factor from the patient side, apart from the life which is being endangered. So though you have to save the patient out of the danger and cost, many times if you are truthful to them and if you explain them and be committed towards them, most of them they do understand. The real problem happens by some third person who was not even bothered about the welfare of the patient, who comes and creates some ruckus. But in that case, if you are at every point, if you are updated on what is happening with the patient, I think the near and dears usually understand this. So that is why, like, you have to spend more time on residency. You have to spend hours and hours together with the patients at the bedside. Not only just it is operating and so leaving, like your pre-op evaluation, your post-operative care, your counseling, all those things, and patient rehabilitation, everything matters. So I think this residency, all of you should love that, and it should come from within. It is going to be your lifestyle for sure. So that on that note, I think I want to congratulate all of you and wish you all the very best for the upcoming residency.
Thank you.
Thank you all.
So how do you assess your performance in grant test? Because as Sir would have told a lot of time, grant test is not to assess, it is just for you for the time management. But now having seen people here, your real ranks, and I think most of it are given your grant test, right? So,
Yes.
Mock test is done by Dr. Dorels.
yeah, how is the reflection on that part?
Sir, actually, the last grand test, I had a all India rank of 50, and I got a 46. Sir. So exactly similar to
More or
that.
less similar.
So it is like if the students, if the more students I have given, if the student have attempted more than 1,000 students, then it would be the actual reflection of your final results. Sir. Yes. So it is very good to access or to see where you sit.
Presently, the point is around 70% of the SS aspirants are using only Dr. Dorels.
Yes, sir.
So if you are getting a rank in SS mock exam, that will be the same rank in final exam also, because more than 70% of the students preparing for last year, our sales was more than 4,000. Among the 7,000 aspirants, 4,000 people subscribe Dr. Dorels. So you can naturally see it will be more or less the same rank. So maybe at the last few weeks, if you put a full effort, you may come forward, or you can go backward if you are depressed in the last few weeks. That's all.
So my example, the last mock what I gave, my rank came up around 110 or 120.
Yes.
What you said is partially right, but don't consider this as like this is end. Okay,
Yes,
my
that is
rank
correct.
will be this much. So unless nobody can predict what questions are going to come and what rank everybody is going to get, so you have to give your 100% till the last minute of the exam. That should be your mindset, no matter how much.
100 rank is a good rank. That is what 100 rank
Yeah.
is.
Yeah,
So up to 200 rank in mock test is a good rank.
Yes, sir.
That will definitely fetch a rank for you. No
I
doubt.
mean, you should see it as
See,
just
only
a,
2 questions will be the difference between a
Yes, sir,
200
very
rank and the first rank. 3 questions will be the maximum difference. That's all.
and it has helped. Like the last this time they changed the pattern. Like
Yes,
the time,
this is like a neat
Yeah.
PG pattern.
So yeah, GTs are the platform where you experiment. Like I was in a confusion till the end whether I should be aggressive with my questions or should I play defensive. Like for 150, should I go till 140 or 148? So all these experiments you can do on your grant test.
Yes,
Then
correct.
you can optimize whichever strategy feels fit for you.